All right, it is Monday, the 16th of March, 2020. Let me give you the look into where we are on the coronavirus. Total cases confirmed worldwide, 171,000. That is up from 136,000 on Friday. Total confirmed deaths worldwide, 6,531. That's up about almost 2,000 deaths worldwide. Total confirmed recoveries, 77,000. That's up 7,000 from Friday. 158 countries now have confirmed. That was 129 on Friday. 4 more have suspected cases. 7% of active cases are now considered serious. This is the best news. 3 weeks ago, that number was 19%, down on Friday to 9%. And today, 3 days later, 7% of active cases are considered serious, requiring hospitalization. This will be really good news if we don't overwhelm our health system with other people going, I've got to have a test. No, you're not going to get a test unless you have the symptoms. You don't need the test. I want to thank our private industry, CVS and Walgreens and Walmart and all of these people that are involved now on the private level. You're going to start seeing tents go up in your area at some of these places where you're going to be able to have the swab test at one of those stores. And the vice president announced yesterday that all of them are going to be free. So you're not going to have to worry about it. Now, is this a sign of things to come? By the way, U.S. has 3,802 confirmed cases and 69 deaths. That's up from 1,700 cases and 41 deaths on Friday. You're going to see this number skyrocket. We are at the beginning of that hockey stick curve that we had in China and we've seen all over the world. We are also doing more tests, but we are now just at the beginning. If you think you're getting rid of your kids in 2 weeks and they're going back to school, think again. Can you buy alcohol on Amazon.com? I don't know if Jack Daniels will send it directly to your house, but whatever alcohol you bought wasn't enough. I think you're looking at anywhere from 4, my feeling is probably closer to 8 weeks of this. We are only at the beginning. People who were mocking this weekend, I think by next weekend, you will see. Do not feel stupid by if your friends or family say, we're not going to, I'm going to just say, well, I'm not going to, and you're not going to be around me for 2 weeks because no, I'm not taking any chance. And they can mock you if you want. It's better to be prepared and made fun of than laugh along with everyone else and then be wrong in the end. I'd rather be wrong and prepared. So don't worry about what other people say. If you have parents that are elderly, please keep kids at home. I know they just want to go to a birthday party. Otherwise, make the decision now. You're not going to see parents until you quarantine your house for 2 weeks. Our parents, if I went on vacation today, Tanya's parents are ill. If I went on vacation today and I didn't take it seriously and I go out and I'm going to Disneyland and I realize they're closed, but I'm just going to eat at the Denny's across the street and I'm going to do all the things I want on vacation. If Tanya's parents get sick, I'm not going to be able to see them. When I come home, I have to stay away from them for 2 weeks to make sure I don't give them anything. In that 2-week period, they could get sick, and then I can't see them. It's not worth it. It's just not worth it. I don't mean to be cryptic, but I've been asked to be cryptic. This is proprietary information. It was prepared for heads of state and others by a company that risks. Let's just leave it at that. And I've asked them for permission to use it, and they've said no. You can use parts of it, and I asked which parts I could use, and so I'm going to give you those parts that I could use because I think this is important. First thing Americans need to know, and the world needs to know, you need to go or stay at the place you want to be if the situation worsens. Focus your decision on being somewhere for 4 to 8 weeks. So if you want to be with your family elsewhere, then you should be there now and stay where you're at. For many people, this means staying where they already are because it's a good place. They have the resources in place, families in the same city. It's a good stock of food and supplies, sufficient security, et cetera, et cetera. I think this is an important line. This is not a prediction that things will be getting much worse, but rather an acknowledgement that things could get much worse. There are 2 ways to make a decision on where you should be. There's 2 things, the social order and the medical. Let's do medical. The medical risk arise from the likelihood of you or your loved ones contracting this particular virus and the availability of effective medical care if needed. Social order risks arise from the interruption of services and supply chain and how people behave in unwanted situations. So for the most part, most Americans will be able to get the health care, just not the way that we're used to getting our health care. We're not used to going in and be swabbed in a parking lot of a Walgreens or a CVS or a Walmart, but that's the way it's going to be. We're used to just going to our doctor. We're not going to our doctor. They're going to tell us to stay home unless things get really bad. You have a They're not going to see if you have the coronavirus right away. They're going to say, stay at home, take aspirin, drink lots of fluid, call me back, let me know. You don't want to be in the hospital waiting room or the urgent care center. They don't want you there. Stay home. So we're not going to be getting the care that we normally get. But if this gets really bad, again, if this gets really bad, which Dr. Fauci has said that he's the head of, not the CDC. Stu, which is he the head of? Well, another one of those organizations. He said that we could be out of hospital beds in the next 8 to 16 days. That's a lot. That's a lot. And that will cause panic in a lot of people, which then risks the social order. You remember years ago, it's one of the reasons why I moved to Texas, I said, be around people you want to be around, in case there's an emergency, people that will help you. How are people going to behave in your area? If you're in an area where people are not going to behave well, you're not going to want to be there. Now, medical risk is influenced in part by chance, precautions, nature, the nature of the virus. I'm reading from the report now. But the social order risks are influenced by fear, moral outrage, anger, and desperation. In other words, emotion. Social order risks can be elevated by many factors. For example, when grocery stores have insufficient stock, I'm again quoting from this document. I think we're okay, but quoting from this document, that's when, not if, and it's all bolded. Some people will behave poorly, impulsively, alarmingly. Those behaviors are another kind of virus that can also go viral. When sweeping restrictions are imposed by government or scary news stories are repeated or clashes with police occur, emotion can gain the upper hand. Italy is a useful proxy for considering viral behavior. In order to COVID-19 infections, officials ruled that prison inmates could not have visitors. Prisoners at one detention facility rioted, and within 2 days, 27 prisons had been overrun. Prisoners were also protesting that they had not received the benefit of testing for the virus. On the medical side, Italy was seeing the reduction of the number of new infections, but at least 6 inmates died as a result of the violence. All 27 prisons were badly damaged, one so that it had to be closed, requiring prisoners to be moved to an already overcrowded facility. Emotion. So is it better to be in a big city or a rural area? Rural locations have fewer people, low population density, and generally fewer risk posed by emotion and behavior. Big cities have the presumed benefit of emergency hospitals, and big cities have millions of other people expecting to rely on those hospitals. And if, as the current rate of new COVID-19 infections require hospitalization increases, the benefit of proximity to big city hospitals declines sharply. In other words, a big fancy hospital is only valued if they have available beds, sufficient staffing, and sufficient supplies. To state this another way, being near world-class medical care is likely to be less value at a price at precisely the time medical care is most needed by many people, because that need overwhelms the system. Every place, the kind of place you might consider, has benefits and detractions. We therefore recommend deciding where you want to be in the event of having to stay for many weeks. If you're already there, great. If not, consider going there soon, because transportation and freedom of movement are not guaranteed over the long run. This is not a prediction of a national shutdown like Italy, but rather an acknowledgment of the range of options available to the government. Let me say that again. This is not a prediction of a national shutdown, but rather an acknowledgment of the range of options available to the government. We restate our recommendation of some weeks ago of having resources sufficient to grant you as little dependence on others as possible, and as little dependence on trucking, shipping, restocking, and continuity of services, all of which is less dependable today than it was last week. Did you hear that? Have as little dependence on trucking, shipping, restocking, and continuity of services. Using groceries is one example. It is not possible for the supply chain to be the same next week as it was last week because the demand has sharply increased. As of today, we're edging into what has been described to retailers as Phase 2. Phase 1 is the virus is present but not yet infected many people. Day-to-day life is mostly normal. Phase 2, we're at the beginning of this. Phase 2, the virus has become or markets where supplies originate, with governments taking restrictive actions such as quarantine or closing schools and public places that result in labor shortages and considerable disruption to supply and demand. To put the rate of increased demand into perspective, last Thursday and Friday, March 5th and 6th, saw a 10% increase in grocery store foot traffic. This Thursday and Friday, March 12th and 13th, the increase jumped to 200% and 300% in some areas. The director of MIT's Center for Transportation Logistics has said the current moment can be compared to what happens in a region expecting a big snowstorm. People stock up. However, the present situation is not regional, it's national, meaning an affected region can only rely on nearby unaffected regions for restocking supplies. There's nobody sending in shipments from Texas, California, or wherever. If you're contemplating a move to another location, it is likely you will have more options today than in the coming weeks, mostly due to the risk of travel disruptions or government intervention to restrict the freedom of movement. If you decide to travel, relocate, yada, 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 I'm just not going to be able to get to all of this. He goes into the things that... important note, if draconian restrictions are imposed, there might be little or no warning or little or no lead time afforded. We learned yesterday the advanced discussions about imposing additional restrictions in San Francisco and Santa Clara as early as next week. That's this week. Information not yet public is shared. Here's an example of the form of such restrictions that it might take. Nobody can enter or exit designated lockdown areas unless they are proven family or proven work reasons. Movements inside these areas is to be avoided unless justified. Closure of all educational and social centers, restaurants, limiting public transportation, and asking everyone encouraging to work from their home. But there are other things that are now being decided at the government level, and more travel restrictions are part of that.